So let's talk about what you should not do if you are on GLP-1 agonist medications like Ozempic or Mounjaro, better known as semaglutide or Tirzepatide. My name is Dr. G, and I am an internal medicine physician in Hollywood, Florida, and I have pretty good experience taking care of patients that are on these medications for either diabetes or for the indication of obesity, which both are FDA approved indications for GLP-1 agonists. Number one, first off, let's get this off the table. These medications are not magic bullets. They're not going to magically cure you of your diabetes or of your obesity. You're going to have to put in work, all right? If you are a diabetic, you're going to have to watch your diet. You're going to have to do some exercise, right? Whether or not you are obese or not. If you are taking it for obesity, definitely not a magic bullet. You're going to have to put in some work. You're going to have to exercise regularly, and you're going to have to change your relationship. I like to call it your relationship with food, right? How you relate, how you go to school, go to food, and why you go to food in different situations is something you're going to have to revisit over the time you are on the medication. That way, when you come off of the medication, the urge does not come back and come back with a vengeance. So let's jump into some of the things I am sure you should not do when you're on these medications, all right? First thing, exercise. You should not neglect exercise. Make sure you get out and get 150 minutes of some sort of physical activity from the jump, from the very first week. If you're a couch potato and you haven't been doing anything, have a sedentary lifestyle, I recommend just putting on some shoes, some shorts, and going for a walk for about 15 to 20 minutes, 2 to 3 times a week for the first 3 to 4 weeks even, just to get used to that routine and get your body out of the rut of the couch that you created by sitting there all this time. Your body has to get used to this activity. Get up, put your shoes on, put your shorts on, put your favorite t-shirt on, put on your favorite headphones, get out and walk for about 15 to 20 minutes. Do that for the first month and gradually increase that from 15 to 20 to 30 minutes, 3 to 5 times a week. At first, you're just out there just walking. Next, you're out there walking with the time. Then you're walking with time and also distance, pushing yourself to go further and further and increasing your calorie burn as you go. So do not just sit on the couch. That's the do not. It's the thing you should not do, number one. Next thing you shouldn't do is overeat. Do not overeat. These medications, one of the way they work is that they slow down gastric emptying, meaning the time it takes from your mouth to the back door to come out is extended, especially in the stomach. So if you overeat, you are asking for problems, especially for nausea, right? So do not overeat. Also, do not eat excessive fatty or fried foods. The excessive oils in these foods actually promote constipation, which is another side effect of the medication all by itself because it slows down gastric emptying and slows down the transit through your intestine. So it's very important to make sure that excessive fatty oils, fatty foods are not part of your diet while you're on this medication because it can promote constipation, which is not fun. We can mitigate that. We can give you medications to promote, the bowel movement, but why if you can avoid it altogether? Do not eat spicy foods. If you have heartburn at baseline before the medication, you really shouldn't be eating spicy foods because now you have food that is sitting in your stomach for a longer period of time, promoting more gastric acid that can cause your heartburn to worsen. Very important to avoid spicy foods, especially in people who have GERD or reflux as an issue at baseline. Let's look at some more stuff that we should avoid. Do not eat refined carbohydrates. Refined carbohydrates in breads and pastas and those foods are a no-no. And why is that? Because they can spike your blood sugar and it makes the medication not work as effectively. Refined foods in general are not a great thing to add to your diet anyway, but especially while on these medications, you should not be doing that, right? You should eat vegetables, but do not eat cauliflower, broccoli, asparagus, or the 3 of the ones that I've seen or I've heard from my patients have given them excessive gas. Why? These gas promoting vegetables sit in the intestines a longer time because the transit is slowed down and it promotes more bloating, abdominal pain, unwanted and unpleasant passing gas and flatulence, we call it, as our medical colleagues call it, flatulence. So avoid those. But veggies in general are a go. We want you to be on nice, colorful vegetables on a regular basis, as well as with your fruits. Do not avoid fruit. Fruit is going to help you, especially if you're not a diabetic and you're using or you're on the medication for the purposes of weight loss. It's going to help to push you through and push your blood glucose, keep your blood glucose up as you're not eating as much. Do not allow yourself to become dehydrated. Another not really talked about side effect or effect of the medication itself is to promote voiding, urination, not excessive, but more frequent urination than you're probably used to. So as you're urinating, just remember to hydrate, because you don't want to dehydrate yourself, which can cause other complications. And probably the worst complication of the dehydration that could possibly happen is renal failure. You want to keep on your hydration as long as you're on the medication. You should be on hydration anyway. Hydration with water is a good idea. Let me take a sip of my water. Hydration, very important. And the other thing that you should not do when you're on this medication, and I've said this before in my other videos, so you probably want to look at the other ones, but I'll tell you again right now. Don't get the medication from your hairdresser. Don't buy it from the lady behind the counter at the dollar store. Do not get your medication from people who are not healthcare professionals, who are, who care about what's going to happen to you after you take these medications. Be wary of medications that are super, super cheap, and you get a vial for like $5. That's not a great deal. It's probably not the medication that you think it is. You can put yourself in a bad situation by getting your medications from the wrong people, and it's not the way to go. You should go to a reputable source, go to your doctor, or go to a clinic that specializes in weight loss or diabetes medications or diabetes control and management to get your medications appropriately and administered appropriately. And you also need some instructions, like you're getting here, some tips. So it's a good idea to not get your medications from Joe on the corner. What else? What we got? One of the most important things that I can tell you is do not go fast. Again, I said at the beginning, this is not a magic bullet. You're not going to lose the 50 pounds that you gained over the last 7 to 10 years, and you shouldn't lose 50 pounds in a month. You should lose 2.5 to 5 pounds max, is equivalent to about 10 to 20 pounds in a month. That's safe and healthy weight loss. That makes sense, and it's sustainable, because if you lose that weight too fast, it's going to come back faster, because you haven't made the changes in your lifestyle that you need to make in order to sustain that weight loss, right? We're looking for lifestyle modifications with these medications. We're not looking for a cure. We're looking for you or I or patients to make the necessary changes in your life and in your lifestyle in order to maintain a new weight, a new baseline weight. And that means having a different relationship with food, and new foods are brought in that you like in your nutrition, and then a new relationship with exercise. So do not expect weight loss to come off 50 pounds or whatever your goal is to come off in a month. From week to week, you should have maybe 2 to 3 pounds, maximum 5 pounds of weight loss from week to week. And that's healthy weight loss. And that gives you time to slowly adjust, to get off the couch first, to add more minutes to your walk, to add minutes and time to your walk. And then eventually, and most likely, you will need to add resistance training of some sort, maybe body weight exercises, calisthenics, or even join a gym, or buy some weights in your home and get started on a resistance weight training program to bulk up and keep your lean body mass and continue to lose fat, adipose tissue, as we call it, in your body as you continue to lose weight. Because you're going to lose lean body mass and fat as you go along. The goal here is to hold up your lean body mass as much as possible while continuing to lose the fat. Another thing you should not do is to avoid proteins. Continue to eat a good amount, maybe a little bit more than what you're recommended to eat of proteins a day, just to make sure that as you're losing preferentially, hopefully, more fat than protein. And on the same vein of do not believe or do not feel as though the medication is a magic bullet, do not push the medication dosage faster than you need it to go. There is no need, in my opinion, and in my practice here, there is no need to push every single patient to the maximum dose. As a matter of fact, I have not reached the maximal dose with, 90% of the patients that I have treated with these medications have reached the maximum dose. And that is either for diabetes or for weight loss. I've seen significant and significant changes and significant decreases in hemoglobin A1C for my diabetics, and weight loss for my patients who are taking it for obesity with sub-maximal doses. The advantage there is that we typically avoid the side effects of the medication, the unwanted side effects, the nausea, the dragging because you're having low blood sugars, the diarrhea. I've even had patients who have had severe constipation come in and like, I had a bad experience with this medication. I had bad constipation. There's no way, but they still are interested in losing weight. I'm like, hey, this is, we can try whatever you like, but let's try again at a lower dose, a much lower dose, and go slowly and get to a point where you're losing 2.5 to 5 pounds a week and see where we are then. Magically, we're losing 2.5, no, I don't want to use the word magically because it's not magic, but 2.5 pounds to 3 pounds a week. They're coming in, they're doing the work of the exercise, and now they are steady rocking on the medication and happy. No constipation, no nausea, no vomiting, no side effects at all. And that's because we don't need to be on the high, not everyone needs to be on the highest dose. So if you are one of the patients that are ordering your medications and getting it to your home, resist the urge to double the dose or triple the dose or go past whatever protocol that you're on. And if you do see that you are on protocol and it just calls for you to increase the dose regardless of your weight loss, if you're losing the 2.5 to 3 pounds, maybe 4 pounds a week, up to 5 pounds a week, you don't need to increase your dose. All you're looking for at that point is for side effects and bad side effects of the medications, not the good ones. So those are some of the things that I would like to avoid with, if I were on the medication, and I tell all of my patients to not do while on GLP-1 agonists, such as Ozempic and Wegovy and Zepbound, and also our friend Mounjaro. Medications that are great for weight loss, great for diabetics. They absolutely work. They're revolutionizing weight loss in this country and all over the world. It feels like it because you can't get them anywhere. Watch out what you're doing. Get some good advice. Form a good team. Accountability team is good. Do that. Get a doctor to check you out. Get your labs checked out. Do an exam and make sure that you are not high risk for any of the absolute contraindications for the medication. Get a mental health therapist to help you with that relationship with food. Do that. Those are the things that you should absolutely do, along with analyzing what you do eat, making sure that you're getting the right macronutrients that you need. There are plenty of calculators out there. Look for your BMR, which is your basal metabolic rate, and your BMR will tell you how many calories are you to consume to keep your current body weight. And many of the calculators that you'll find on the internet will be able to calculate how many calories can I consume if I wanted to be 150 pounds instead of 190. You punch in 150 pounds, your height and your weight, your gender and your age, and then it shoots out a number, and that tells you how many calories that you can take in a day as a 150-pound version of yourself. So now you're forcing your body to work on calories at a deficit from the jump from your weight, because you're not eating enough calories to keep your weight at 190 pounds. Add on to that the new exercise, getting off the couch and putting on your sneakers and your shorts and just walking down the block and coming back for the first couple weeks, then walking up and down the block for 15 minutes the next few weeks, and then doing that with a purpose and getting up and down the block for 30 minutes and trying to get 3 miles in at that time, and reaching these milestones, the weight will come off. It'll come off on its own. You don't have to push it. You don't have to push the medications to the limit and risk any of the side effects that many of these people are on the internet and your friends around the corner and the lady at the dollar store is telling you about these medications. The do's and don'ts, mostly the don'ts, of the GLP-1 agonists. You can find everybody's on the internet, and everyone else It's trying to tell you what the do's are. But not a lot of people tell you what the don'ts. The don'ts are just what I told you. Probably a couple more, but you got to come and see me for those. All right, now, I'll see you soon.